Good evening, my viewers outside there. You're most welcome to the Health and Lifestyle channel. Today evening, I'm privileged to host two gentlemen who will be discussing about one of the mental health problem, and that is schizophrenia. I will request them to make sure that they break it down such that everyone out there, they are in position to understand and they know how they can manage themselves, how they can prevent themselves from acquiring the disease. So first of all, I will request my dear gentlemen to first introduce themselves to the viewers.
Thank you very much, Letitia. My name is Semakola Hasham. I am a clinical student from Fort Portal College of Health Sciences. Briefly, that is my brief. Those are what concerns with me.
Well, thank you, our dear viewers and listeners out there. Madam Moderator, thank you for this opportunity. My name is Atikwasi Alan. I'm a medical clinical officer in making. Today, I'm privileged to be here to share with you a mental condition, schizophrenia, what most of you people out there are living with, or you have your relatives, you have your people who are living with it, but you haven't noticed it. Today we shall be giving you some brief information about it that can help you to know or rule out that your person or you yourself, you are a victim of this condition. Thank you very much.
Yes, thank you so much for taking this very step to come and educate the population out there on certain health conditions. So I'll begin with my colleague here, Mr. Hashim, to first take us through the definition, because I know people outside there, they are wondering like, what is schizophrenia? So I request him to first define it for us and then we proceed.
Briefly, in short and in a layman's language, schizophrenia, this is a mental disorder which is usually characterized by sprinting of the mind. A Swiss psychiatrist differentiated it into two. A Swiss psychiatrist was called Eugen Buera. He split it into two, whereby he said that chicks meaning sprinting, then phrenia meaning the mind. So briefly, schizophrenia is a mental disorder which is characterized by sprinting of the mind. It is a mental disorder that usually affects people who are introverts. In short, it affects people who are introverts. Briefly, that is a brief explanation about schizophrenia. Thank you very much.
All right, thank you, Mr. Hashim. But I know people out there, they are still wondering like, who are the introverts? Maybe you can tell us who the introverts are.
The introverts, briefly, these are people who are not social. In short, who are not social. These are people who are always there. They don't socialize with others. They are always quiet. Briefly, those are introverts. People who, you see, mental disorders, it is usually the extension of the normal. Once somebody is always quiet, but once the quietness extends or exceeds, somebody from the morning, since morning he hasn't spoken anything, that is the abnormal. It is the extension of them. Somebody has been quiet, but now the quietness has extended. It is now abnormal. So mental disorders, that's how it is, the extension of them. So if you laugh from morning up to evening, that we quote, this person must be having a mental problem. So mainly that is introverts. Introverts are people who don't socialize, but if the not socializing extends and exceeds the normal, we say this person might be running into schizophrenia. Briefly, that is it.
Yeah, all right, thank you so much. Personally, I didn't know that when you're very quiet, you can also develop a mental problem. So thank you so much. So now I can welcome Mr. Alan to take us through the statistics.
Well, thank you, Madam Moderator. I'm going to take us through the statistics. When we talk about the statistics, we mean what is happening in the general population, in the world, in the countrywide, what is happening. We are going to talk about statistically how is this manifesting, how is it moving around in people. Schizophrenia, usually the onset is earlier in men and the symptomatology is less severe in women than in men. This is because there is an antidopaminergic influence of estrogen in women compared to men, and schizophrenia is more common in men than women, with a greater ratio of 1.4 to 1.1 in male to female. The prevalence of the disease or the disorder is that about 1% incidence, 2 million per year worldwide, affects people. The lifetime risk of schizophrenia is estimated to be 0.2 to 0.7%, with an annual incidence of 11 per 100,000 people. The variation and prevalence of the disorder across populations, ethnic groups, and geographical region has been suggested. Now, the mortality and the morbidity rate of these people who are succumbed to the mental disorder is that at least 10%, or this schizophrenia, we can say it is also a predisposing factor to suicide, and the mortality is also increased because of medical illnesses due to a combination of unhealthy lifestyle, side effects of the medications people take, and also decreased health care. Over 40% of the patients of schizophrenia, normally they have abused alcohol and drugs. Also again, to the socioeconomics around there is that apparently the trend towards which the prevalence is higher is lower to the downfall of people, and the tendency is that individuals with disorders to have been socially and economically disadvantaged. Thank you very much.
Yeah, all right. Thank you so much, Mr. Alan. So now I would like maybe one of you to tell the viewers outside there, how can one know that they have schizophrenia? Like, how can someone know that this person is suffering from this disease? I think they are called the signs and symptoms for someone to know that maybe this person has schizophrenia. Thank you.
Thank you. Before going to the signs and symptoms, Madam Letitia, for every mental disorder, for you to say that someone has, because schizophrenia, as we shall see, it is a very dangerous disease. Once you diagnose it as a health worker, once you diagnose it on someone, that someone, the person you have diagnosed it, there and then we have lost the job, because it is a very bad disease. And two, it is a very dangerous disease. So we have a criteria we should follow for it. This one has a what? Because not all that someone may have one sign, but he is not into the psychopath. He's not having schizophrenia. So there is a certain criteria we should follow. First of all, the signs must persist. Because someone can be annoyed and maybe he doesn't speak for 2 or 4 hours, but that one doesn't make it a sign of that person being schizophrenic. So the signs and symptoms must persist. They must occur in combination. Never and never see one sign in someone and say this one is having schizophrenia. No, that one is not right. Thirdly, they must create concern to the patient himself, to the relatives, or to the community. For example, in schizophrenia, under the signs, there is where we shall see at times they become violent and irritable. So these people may start fighting, may start destroying people. That is what we mean by creating concern in the community or to the patient themselves. At times, some people they can resort to drugs. There is where we shall find they have resorted to drugs. So for you to diagnose schizophrenia, those are the criteria you should follow. Especially when we say of the signs, they should persist worldwide, or the World Health Organization usually gives 2 weeks. For you to diagnose schizophrenia, these signs and symptoms must have at least been there, or the patient must have been having them for at least 2 weeks. From there, I think Mr. Allen should talk about all the signs and symptoms, then I will add on. But generally, that is the criteria we are supposed to follow before diagnosing any mental illness.
Well, thank you, Mr. Hashim. About the signs and symptoms of schizophrenia, they are not that much, but there are some signs we follow and say that if someone presents with these signs and these symptoms, they help us to rule out and confirm schizophrenia. One of them is if someone has flattened affect, someone has autism. We shall explain them briefly. Let me first go them through. If someone has autism, someone has impaired association of ideas, someone is ambivalent, that is the coexistence of love and hate towards a certain object. Then part of the symptoms we categorize them into two. We have the positive and the negative. On the positive ones, we have delusions, we have hallucinations, we have disorganized behavior. Then on the negative ones, we have blunt affect, we have alogia, and inability to feel pleasure, also inability to socialize. My colleague here will go them through in details. Thank you very much.
Thank you, Mr. Allen. To continue with the signs and symptoms, when we are diagnosing actually all the mental illnesses, there is a certain we usually see in the thought. You see, the mind is divided into three parts. We have the conscious mind, we have the subconscious, and the unconscious. So, what am I saying? Whenever you are speaking to somebody whom you suspect to be having a mental illness, you should not always depend on his or her words, but depend on the way he has said them. You see the gesture at which he has been saying them. That's how we get the signs and symptoms. Never and never depend, because we say in the medical word, we say that the patient only tells you 3%. The other information you get from the way he has said the words, how do they call it? The code to which the notes at which he utters out his words, the expression, the facial expression. If you say, "How are you?" If he takes time to say, "I'm fine," it means there is an issue. So that's how we do diagnose the mental illnesses. First, what was I saying? In the thought, what do we see? We see the stream, we see the form and the content. Under the stream, what do people with schizophrenia do have? These people usually have, actually before that, in the speech, they usually have word salads. We say it is word salad. They usually talk incoherent and irrelevant speech. If you say, "How are you?" he will say, "I'm coming from town." So you have asked a question. What you have asked is incoherent and irrelevant. Unlike in mania where the speech is coherent but irrelevant. In mania, if you ask someone, "How are you?" he will say, "I'm fine, I'm Bosco, I do this and this, I'm fine, I'm John, I do this and this." He talks more. But in schizophrenia, someone says something which is very irrelevant and incoherent. So from there we go to the stream. In a stream, these people usually have what we call, I can say it is, how can I say it? They usually have what we call thought blockage. Thought blockage. How do you see thought blockage? Somebody is speaking, there and then he mutes. He stops speaking. You have been asking, he has been responding. From there and then he mutes. From there we go to form. In the form, they usually have what we call reasoning of association of ideas. Their ideas are not coordinated. That's what I told you, that they usually have a coherent, incoherent, and irrelevant speech. So their ideas there is reasoning of association of ideas. Their ideas do not match. From there, we got what we call the content. In content, those who do mental, there is what we call delusions and short alienation. These people usually have they usually have what called passivity phenomenon. Usually have the passivity phenomenon. They believe whatever they are doing is under the control. It's not under their control. There is something telling them that you are doing this. There is something telling them that you are doing this. Then another sign of schizophrenia is what we call hallucination. And a hallucination is having a sensation which is not there, and like an illusion. An illusion, something is there. You say a rope, you call it a snake. But for a hallucination, something is not there. For example, these people usually have what we call auditory hallucinations to third person. They hear a voice commanding them, do this, or a voice commenting on their action. For example, if I'm seated, they will say, Hashim, you are seated. If you walk, somebody hears a voice telling you, Hashim, you are walking. If somebody maybe is digging, doing what, the voice so somebody will always be telling you, I hear a voice telling me this, I hear a voice doing this. Generally that. Then in South alienation, they usually have South insertion, they have South withdrawal, they have also what we call South broadcast. What do I mean by South insertion? South insertion, you feel somebody is inserting ideas into you. Somebody is inserting ideas into you. South broadcast. Whatever you think of, you find that people know it. For example, if I have an idea, by the time I reach into people, I haven't told them anything, they feel as so. That's how what their mind. That's how they usually feel. Whatever they have developed into their mind, they find it is already done. They feel like it is already done. They find other people have already done it. So generally, those are the signs and symptoms of schizophrenia.
Yeah, thank you so much, Mr. Hashim. I think he has said it all. But one thing I would like to know from you, our dear colleagues, these people with the mental health illnesses, do they always know that they are sick, or they don't know? Mostly in accordance with our topic of today, schizophrenia. Are they always aware that they are sick or not?
Mainly in schizophrenia, most people don't know. Why? Actually, schizophrenia, it is what, as I have already told you, it is a disease. Actually, even the community at times they don't know. It is even the community at times they don't know. But how can one know? Those are the signs which I have told you. You have to see them, because most of them they don't know that they are having schizophrenia. And as I've told you, the disease usually affects the introverts. So the community will always believe that's the way he is. That's the way he is. But what are the diagnostic, like the key feature you should base on, say that this person is having a mental illness? First of all, I told you, incoherent and irrelevant speech. The moment somebody has been responding well, but at this time you ask, good evening, he says, I ate lunch at this time. The speech is incoherent and irrelevant. Whatever you have asked is not responding. Two, these people are usually unkept. They become unkept. They don't want to bathe. They don't want to wash. They no longer participate in the previously done activities. Generally, that is schizophrenia. They are unkept. Three, they become irritable, easily irritable. Most of them, they start destroying maybe houses, they start destroying where they are living, they start doing irrelevant, very awkward things in quotes. They start doing things which they have not been doing. They are irritable. Anything, he starts fighting, he starts doing what? Actually, in our culture, in African culture, they usually associate with witchcraft. That's why mental illness is becoming an issue in Africa, generally in Uganda. Whenever somebody gets, let's say, schizophrenia, or in quotes, they say mad people, of which it's not a good term in psychiatry, we don't use it, but they say mad people. Why? And that thing is making mental health very difficult to manage in Uganda.
Yeah, all right. Thank you so much. But you said that these people are always irritable. So, you health workers, how do you always try to manage to ensure that you give medication, to ensure that these people come back at least online? Mr. Alan, you can talk about that.
Well, thank you very much, Madam Letitia. Uh, Normally, when these psychiatric patients or these people who have schizophrenia, like we said, we schizophrenia or psychotic disorders or psychiatric disorders, we do not have specific laboratory investigations we can do to say that this person has schizophrenia. Only that, like we explained to you, we have a diagnostic criteria, the way we told you, the signs, how they have to persist, how they have to present. Normally, we have what we call the biopsychosocial model of management. We look at them biologically, we look at them socially, and then psychologically, we manage them psychologically. When we look at the biopsychosocial model, here, normally what we do is that if someone comes and we have collected all the necessary information and we have appreciated that this person maybe is having schizophrenia, here are some of the remedies we give, or here are some of the things we do. Well, out there we have some psychotic drugs, we have some psychiatric drugs, we have in the health system. If you're out there and you have your person there and you have been noticing all the things we have just said, you can run to your healthcare providers. We have psychiatric nurses in hospitals, we have psychiatric doctors, and even counselors. You can reach there for counseling. They will give you the best way, the best remedies, how you can live with these people, because when someone is having schizophrenia doesn't mean that this person cannot coexist with others, or it doesn't mean this person has to leave society. There are counseling sessions. These people can go for counseling sessions and we see how we can help them. Normally, we advise the family members to be with them, all in tough times and with them all the time, such that they can have a sense of love. They are being loved. Uh, with those few, allow my colleague to add on.
Thank you, thank you. With the management, actually, before joining the medical school, I thought maybe in Butabika they have maybe even soldiers who do what, who keep these mental ill people. But these drugs do miracles. We have drugs, the likes of the CPZ and other, which I will not go into. But these drugs do a big miracle in doing that. These people are supposed to be given drugs. In case the patient, especially in schizophrenia and mania, in case the patient is not cooperative in taking these drugs, we have injectables we can give for months. For a month, you give one, then as you check, you keep on checking. Is the patient responding? Is the patient still irritable? Is the patient, are the signs and the symptoms, is the patient now starting to clean himself? Then there is also what we call the psychosocial therapy. How do we manage? For example, if this person does not base, what do? You can say, if we don't base today, no eating. That's how we deal with mental illness. There is what they use to call it, you appreciate, a response, you give an appreciation, you give a reward whenever somebody does something good, because he has run into psycho. Whenever somebody does something good, you appreciate. Maybe you say, if now you base every day, if you base, I will do something. That should be done in liaison with the medical workers and the caretakers. You have to set rewards for this patient. You say, if now you base, you get lunch. If you don't base, no lunch. So, but this you do it when somebody at least is having, because if it is still severe, if it is still acute, it may not work. But if somebody has started to recover, you say, if you don't base, no food. If you don't bathe, no this. Then if you beat people, I want to do this. So that appreciative way of treating people. But apart from that, we also have drugs which do miracles. Lastly, lastly, schizophrenia, it is usually a chronic disease, usually taking years to recover. However, most health workers, once he or she sees somebody with schizophrenia, they think it will easily go, which is not usually good. Most of them ask for big amounts of money, of which schizophrenia, for it most of the time we initiate people on drugs and we see if they will recover. And there is a certain criteria which they follow to see if somebody has recovered or has not recovered. So my dear health workers, if somebody has schizophrenia, please don't hurry to ask for money, because the condition may not heal. Actually, the prognosis is not good, especially for these the big types of schizophrenia, the catatonic and the hebephrenic types of schizophrenia. The prognosis is not usually good. Generally, that's what I can say about schizophrenia.
Yeah, all right. Thank you so much, Mr. Hashim. So I would like everyone to highlight at least 2 points maybe, or try to explain, because personally I've already seen that these mental health problems are common in people of lower socioeconomic groups. So in your own views, why do you think that it is very common in people of in people of lower socioeconomic status?
Well, thank you very much, Madam Letitia, for bringing up such a good question. People of low socioeconomic status, why these mental illnesses are more common in them is that itself is self-explanatory. We want to run out to the government out there to increase on facilities that can help healthcare providers to diagnose and help people. Again, it goes to maybe increased rate of poverty, gender-based violence amongst the people out there. In other words, you find people, because of their status, someone has produced children and this person has failed to educate their children. They suffer and they find themselves running on streets. All this kind of lifestyle that is not good exposes or is one of the predisposing factors to the people of a low status. Another thing is that the government should come in with an initiative of reaching out to communities, making some community diagnosis, making some community visits to check on people and assess for mental health. Because someone may be there, they think they are okay, but when you do a mental state exam and assess for mental health, you find someone is deviating from the curve, and this is some of the things the government should run out, and also as well create some good sessions to train health workers on how to manage psychiatric patients. You mismanage someone, or someone comes, has a mental illness, and because of low knowledge or insufficient knowledge about psychiatry, some health workers misdiagnose people, yet they are psychotic or they have some mental illnesses. With those few remarks, that's all I can submit in.
Yeah, thank you so much, Mr. Alan. So now we can listen from Mr. Hashim on what he has to talk about the socio-economic status, how it affects the people out there and they suffer from schizophrenia.
Thank you, Mrs. Madam Letitia. For me, I would say people with a lower economic status, the lower the economic status, the higher the ignorance. Why? They are taking people with schizophrenia to witchcraft. These low economic people, they are taking schizophrenia to witchcraft. They are taking people with schizophrenia to pastors. You find a pastor praying to somebody with schizophrenia. Why? Actually, the government should put for somebody to become a pastor, you should have a certain degree, over a certain level of education you have reached on. How can they bring you somebody with schizophrenia and you start praying for him? This is a mental illness. It is in it. You are supposed it's supposed to be managed mentally, but people out there are praying for people with schizophrenia. For my thought, we're health workers. We are the one who are supposed to refer to God, such that God can intervene. But where we have not failed, we should not. Generally, the pastors, actually the religious leaders who are praying is good, but let's accompany the treatment. Let the people take people with mental illnesses to hospitals because there now at the all regional referral hospitals in Uganda, people are having what? The hospital is having the mental unit. Take those people to the hospital. People stop this habit of taking people to churches, taking people to shrines for rituals. That's mainly people are ignorant. They don't know that a person who is normal can also develop a mental disorder. Somebody can run into a mental disorder. That's the issue with the people. Most developing countries, the people are going in shrines, people are going to churches, to pastors for prayers, of which this is a mental condition which is supposed to be managed by health workers. With those, I urge the government to intervene by making sure these pastors are regulated in the way they do their work, in the way they are managing their things, because people are going to pastors, are going some, and when they reach there, the pastors even don't advise them to go to the hospital. They keep on praying, of which the disease is alarming. So generally, that is what I can say about the low economic status.
All right, thank you so much, Mr. Hashim. I think generally that is it. So my viewers outside there, don't be discouraged from praying. I know medical workers, they always feel like people should always come to them and seek treatment before you go to these pastors, priests, anywhere, to any churches according to your different denominations for prayers. So ideally it is better when you seek for medical attention, as they also come in to pray for you, so they are not discouraging faith. It is good to believe in God because God heals. So with that, I request everyone to conclude on our topic, and we stop there.
Well, our dear viewers and dear listeners out there, I think there is much you have learned. If you have been in the society there and you had not noticed this, I think this is a good platform where you can learn and get something. We thank you for your continuous support. My dear colleagues, thanks you for always bringing up such good conditions, and we could give some good light to the community out there. Thank you very much.
Thank you. In my conclusion, I will end up by saying that mental illnesses are really there. People should come to the health centers in case you see an abnormality of the normal. As I had already told you, in case you see the abnormality of the normal, somebody has been laughing, he laughs, he stops, but now he's laughing all the time, or he has kept quiet all the time. It might not be schizophrenia, it might be another condition, mania, it might be depression. Please seek for medical attention from the psychiatric officers. Go to regional referral hospitals. Those units now have been put in place such that we can live a better life. Thank you.
Yeah, all right. Thank you so much, today's panelists, for taking this good step to come and talk about this great problem.